Hello, this is Catherine Marie, and you are listening to the Long COVID Real Talk podcast. Today, I just need to process the more recent doctor's appointments that I've had. I feel like the purpose of the appointment has been met, but each one kind of hits me and sucks away my confidence, my knowing that I have long COVID and that knowing I'm disabled, and it's like you're questioned so much that it's hard to know if you even believe yourself and what you're experiencing is valid. A lot of the things that are expressed are just micro expressions or just the tiniest little things. If someone else saw a video of the appointment, they might not think anything of it, but to be the person sitting there and to have them kind of questioning, like, why I don't exercise more, or how infectious disease doesn't really have a place in long COVID treatment, or I don't know. Today, I also got a letter from Workers' Comp where it was like a 4-page, single-spaced, one of those things where you have to answer questions about every possible movement and if you can do it, and if so, for how long, and why you can't go back to work. And it's just like, it's a questionnaire that was originally made for someone who had a back injury. And it's frustrating to have to jump through all these hoops when all I want to do is just rest, and I just want to get better. And instead, I feel like I'm fighting to keep my income that I'm getting from Workers' Comp. So I just feel really down today. Like, I just feel like I miss the person that I was. I miss the power that I felt and empowerment I felt in my life. I feel like I've gone from somebody who is important and does important work to somebody who's just a nobody, who is considered a goofball by the people that see me in clinic. And, just to not be believed, it's just so hard. It's so hard to feel like you're telling the truth, you're explaining exactly what happened, and people are looking at you like you're crazy. And it just doesn't get any easier. I really, really liked my chronic fatigue clinic appointment because they completely understood, but the general population of medical providers has no freaking clue about anything related to long COVID, and they have no idea how to treat it. They have no idea what to do, and they're not comfortable learning about it, or they just don't have time to learn about it. So I don't know. I just keep going around and thinking, well, is it my job to teach these physicians what it is to have long COVID? They're not going to listen to a podcast. It's not going to matter about the personal experience, because in medicine that's considered anecdotal data. It's not real data. So you know, do I find studies where they're using antivirals to show the infectious disease doctor that they do have a place in treatment of long COVID, and that other infectious disease physicians are working to try to help people with long COVID? And the cardiologist who told me to exercise more, do I send him the Nature article that talked about how exercise in long COVID patients causes the cell destruction, in our body tissues? It's just like, these are basic things about long COVID that everybody who has long COVID knows about, like the first month they have it, just from listening to other people who have it and learning from them. Like, I didn't know that I had POTS, or at least orthostatic intolerance, until I started listening to the people in the groups, the long COVID groups. I had no idea why I was tachycardic when I stood up, and why I got short of breath and nauseous and started tremoring, and I just have to sit down all the time. I just have to sit down or lay down. It's just, I don't know, it just feels so bad to feel like you're not believed. And they do what looks appropriate on paper, they're covering their butt, but they don't really believe you. And especially as a nurse practitioner, it is so hard, because I know the system, and I know what things mean when they ask a certain way. And it's just, it just is very isolating to feel like my own field that I've spent so many years training to work in and have taken care of so many patients, that when I am a patient, I am not believed. It's very frustrating. And I was one of those people that did believe every patient, because they wouldn't show up in the freaking doctor's office if there wasn't something wrong with them. I don't understand why medical providers don't get that. I've had a few good ones, but a lot of just really mediocre ones as far as their knowledge of long COVID. I'm sure they're good in their own specialty, but the first thing that you need is to establish a rapport with the patient and create a therapeutic relationship. And if you go in there and your doctor doesn't make you feel believed and kind of questions why you're not at work, why you're not working for so long, it's so degrading and demoralizing. And it just puts me in this depressive slump for hours to days afterwards. And I'm hoping that just talking about it will help alleviate the psychological pain that I'm experiencing, because long COVID is so horrible. There's so many symptoms. And then when someone starts to ask you to explain long COVID, it's like trying to say, okay, I understand that the ocean is filled with drops of water. Can you please count the drops of water in the ocean and explain how many there are? That's how it feels. It's impossible to explain all the symptoms of long COVID that I've ever felt, and why, when they're waxing and waning, what waxes, what wanes, what new ones you get, ones that went away but they might come back, your baseline symptoms, and then the symptoms that you get when you have a crash or a flare or whatever you want to call it. It's just so hard to survive and exist with long COVID, and then to have people question you and make you feel like you're some weirdo that's just coming in for attention or something. It just really, really affects me, because I didn't do that to people when I was a medical provider. And I hate to say it, but each time it's happened, it's been men that don't really believe you, but I'm sure that women don't either. I just have been seeing more male medical providers lately. So, yeah, so that's pretty much it. Please reach out and let me know your experience with this. I understand, like, these are the times when you think to yourself, yeah, I understand why people complete suicide or like really consider suicide, because it's like your life is so hard to live, and then your doctors don't believe you, and then workers' comp is like banging down your door to have you go back to work, and you have to keep proving that you're sick. And it's hard to prove because long COVID has no treatment and no test. And it's just like the most ridiculous thing ever to try to, like, it's madness to try to live your life with long COVID. Like, it's laughable how ridiculous the stuff we have to go through is. Okay, I'm gonna stop there. But please email me or text or whatever your stories. I need to hear them. I need to know that I'm not alone. And thank you for listening. I know that this is not a unique experience, and it makes me so angry because I can't imagine going to these doctor's appointments not being a nurse practitioner. And I can't fathom how horrible it would be to come in as a regular person without the medical background and then be treated like that. Like, I don't know if it's worse to be a medical provider or if it's worse to have no background and be trusting the medical system and then have them, pretty much let you down. That's what it feels like. And I know you all know this. I know. But yeah, it's just like this, and then there's the financial pressures, and then it's everybody's Social Security disability gets denied, and it's just like the only thing I'm holding out hope for is just getting the hell out of here so I can retire and do the retirement thing. But then I'm going to take another pay cut. It's just like there's no end in sight, really, unless I am cured somehow. So anyway, please subscribe, share, all that stuff if this resonated with you. Thank you for listening, and we'll talk again real soon. Okay, take care. Bye.